Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the public sector and voluntary sector partners. Please welcome today's host, Beverly from Transport for Sick Children. Over to you, Beverly.
Hi, thank you very much. Hello. I know there's only a few of us, but I'd like to say I put lipstick on for us all anyhow, so we can make it a little bit more casual. So yeah, I'm Beverly Hoyle, and I am the communications and funding manager for Transport for Sick Children. But I do have another kind of title as well, which is stakeholder coordinator. So, but it all fits together and everything. So Transport for Sick Children is a charity, and we have been in operation for over 40 years now. Have you got the presentation there, Hayley?
Do you want me to share it?
Going for 40 years. It started in a founder's kitchen. You've got my notes on there as well. There we are. Perfect.
That better.
Thank you very much. There we are. We can start again almost, really, can't we? So Transport for Sick Children. That's our logo. We've kept that logo for 40 years, and we intend to keep it for a lot longer. So just to take you through to the next slide. So the mission statement of the charity is to reduce the stress felt by sick children and their families by providing transport access to health care in a friendly and supportive way. There is actually two words missing out of there, and that is low income. So sick children from low income families. These are families that can't afford to own a car or don't want to own a car, you know, and mainly because they don't own a car, and so are reliant on public transport, but also have a low income, so don't have much funds to spare. So that's the mission statement. It will change. It will have low income. If you could go to the next slide, please, Hayley. Okay, so the charity was started by a paediatric nurse, Sally Carroll, who is now an MBE for her work that she undertook with this charity going. She worked with, what happened, she was working with a family and it was failing to thrive, the child. The child was in danger of being taken into care. Sally decided to unpick what the problems were because the family were not managing to get the child to hospital appointments and therapy appointments. Turned out that they couldn't afford it and they had no transport to get there. So Sally brought in her family and they started helping transport the child to the therapy session. The child started to thrive, was not taken into care, and that so was left to home. So I think it's kind of really interesting starting, really, because if you'd have thought that that was going to be the problem, that it was just a small part of the network that was getting there. So her own family helped take them. That was, whoops, I'm back. That was the beginning of, next slide, please. So there is a criteria, and the criteria is for use. Can I say this has also happened to be the first time I've done this presentation, so I'm already going, no, this is in the wrong place, but never mind, next time. And that, but anyhow, there is a criteria. The criteria is that the child has a hospital or health appointment, is under 16-year-old, and is referred by a health professional. That is also under review at the moment because we quite like to widen the criteria out. The family also has to be on benefits or on a low income and don't have access to a private car. So once they fit all that criteria, the charity takes over and we will work with the family. We are fully compliant with all legal regulations. We have volunteers. We've got about 35 volunteers, or we did have. They're all volunteers. They're all cleared for the DBS. They're all trained in safeguarding. All their vehicles are roadworthy, and child and baby seats are supplied. Can I have the next slide? Right. Because this So here we are. Let me introduce you to the volunteers. Up until recently, we've had 35 volunteers, and Ronnie is one of our volunteers there. Now that's about 10 years old, that photograph. And this slide is really quite old as well, relatively speaking, given recent events. So even when I was putting this slide into the presentation, I was thinking this needs more discussion around it, because if you see that it says got 35 volunteers, 10 to be retired people, some of them are registered disabled and have mobility cards. Most of them are older people who are keen to remain into their communities. But you know, almost while I've been putting the presentation together, that has been changing, and the profile of volunteers that have come that have been changing, and that. But we're in that period of flux at the moment. So, so that's Ronnie. I think I'd really like to come back later and talk more about volunteers, because in a little bit, in a couple of slides, I talk about what's been happening over this summer with COVID and how the charity has been changing. So what you've got here is, like, you know, even my presentation is not as slick as it used to be, because I used to know what I was talking about and no longer do, because of all the changes that are taking place. So we've got there. So if you go to the next slide, you'll see that our volunteer drivers are accessing a range of hospitals, starting with the Manchester Royal. There are the MRI, that is one of our major destinations, but increasingly we are now moving on to working with Alderhay in Liverpool, Birmingham, a lot over in Newcastle. No, not many in Newcastle. Some over in Newcastle, some over in Yorkshire, and that be for specialist treatment. So we've got there. We're also going to a lot wider number of local district clinics as well, because treatment is being delivered there for specialist treatment. And what this means is that families now have to travel long distances, over long distances, taking a great deal of time and taking sick children to them. And it's really badly affected most of those families. Can we go to the next slide? I'm kind of looking forward to getting off this bit, because I think this all gets more interesting now, really. So when I was putting the presentation together, I even noticed that when I've had to reduce the amount of the size of the font of the text on the presentation, and that's quite indicative of what's going on at the moment. I'm squashing it up to fit. It's the same in our work as well. We're squashing everything in to fit into an old system that we've got going, but now we need to change. And I don't really feel like I've given you a good introduction to the charity. If I had my time again, I'd restart all this from a different position, I think. And that, but if I take you over this year, so we've got all the, very quickly, our volunteers had to go into, because they're quite old, they had to go into sexual isolation quite fast, and we were reduced very quickly to a tiny number of volunteers who have worked for us, who are very dedicated, come on a daily basis, really keen to get involved, but most importantly, felt fit and well enough to deliver a service, unlike the other volunteers who had to go into isolation. And that, but so most of the discussions were going on through March and through April. By May, we started receiving a lot of information, and a lot of PPE was coming through to us as well. So all of our volunteers were able to, some of our volunteers were able to start taking on taking on trips again. After that, so over the moor, we started receiving the PPE. Once we started receiving the PPE and we started talking to our volunteers, we were able to start getting the service back up and running. It was complicated, and we were thinking our way through this in the same way as I'm trying to think my way through this presentation to make it work. In many ways, it reflects the summer that we've had. you know, that we were thinking continuously on our feet. And right at the very beginning of all this in March, we were saying to families to refer us to volunteers. We actually really don't know what we're doing. We are finding our way in the same as everybody else is, but we are looking at where we can get all our information from. So there is a slide later on where I'm really quite grateful, and the charity is quite grateful for the amount of information that's coming through to us from not only from places like the National Council for Voluntary Organisations, the NCVO, but also from organisations such as EMCVO, the Greater Manchester Council for Voluntary Organisations, from all of the local district networks who came together either on a health basis or on a transport basis, a general social inclusion and access basis, to make sure that all needs were being met, especially for those people who were most vulnerable. So we work with some of the most vulnerable families in our conurbation, you know, so they've got very little money. Many of them have their own health problems, the adults. So they have children with health problems. They have complicated circumstances that they are living in. So they are the people who would normally, you know, quite easily fall through the cracks. So the charity would have felt really strongly that we weren't going to let this happen with them. But this is not something that we've undertaken on our own. This has been something that we undertaken in partnership with many of the other voluntary organisations throughout the whole of Greater Manchester that we have been networking through all of the new networks that have come through. So through that group, those groups and those networks, we started to acquire PPE. We started to get information through. We were also looking at what was happening throughout nationally. So the Community Transport Forum was just about, which had been operated by Transport for Greater Manchester. It was just about starting up again, but it was not able to find your feet, but it was there, and people were connecting and networking and sharing information. So very quickly we were able to put together a risk assessment, which we developed and published and widely distributed. The risk assessment we got from Proforma, from the National Council of Voluntary Organisations. We adapted that. Then we published it widely. We sent it out to all our, and I've got copies of that that can be sent over to anybody afterwards. And that, so yeah, and we put that out to referrers, to network organisations and groups, to our commissioners, the health and social care partnerships, all of those. So everybody, just to say, hey, we're still here and we're still operating, and we are actually adapting and adjusting in order to continue to have a service that meets COVID guidelines. So during the complete lockdown, our staff stayed in contact. We have three ladies, who are our transport coordinators, and they are the people who negotiate and talk to referrers, families and volunteers, and coordinate those trips so that our volunteers go to the house, pick up the child and a carer, take them to the hospital or therapy appointment, wait for them, and then we pick them up at the end of the treatment and return them home. That means that the family are not stressed, not worrying about how to get there. It's such a basic little thing, but so vitally important for them, because without it, they don't get there and they don't receive the treatment. But that means that once they arrive to take treatment, they're in a much more relaxed frame of mood, which means they're more receptive to good outcomes that come out of that. And many of our volunteers and the transport organisers develop quite strong relationships with these families, you know. So these are the families that we need to fit around as opposed to asking them to fit around us. So we will pick children, we will pick a carer or mum or a parent, father, up from their home, go to school, pick the child up from their school, take them to the appointment, send them back to school and drop them off, which means that, you know, they're not doubly burdened by not attending school and not having a good education. So making sure that that groundwork is all in place, you know. So it all managed to keep, we did manage to keep the structure in place throughout all of those difficulties. Can I go to the next slide? By summer, we'd got, by the summer, most of our 50% of our volunteers had returned, and that now the other 50% are still out. We don't know whether we're going to get them back or not. We may get a trickle back on that. So, but this next slide is about how we found it that it was important to we maintain contact throughout all this with our referrers, with the families, with the volunteers. So newsletters going out to the volunteers, email communications going out to referrers, phone calls going out to families to talk to them, reassure them that, because many of these families have children that need life-saving treatment, such as regular monthly blood transfusions. Most of them are immune compromised, you know. So, so it's a very specific, very targeted service that we give them. We did welcome messages throughout the period, which are still coming through. So, for instance, we got the information from the Combined Authority and the Social Care Partnership to say that our budget will be automatically renewed, and they've given us to understand that it will be for the immediate future, and that we are not held into previously agreed targets and outcomes, because obviously we can't meet that with half the staff, half people being in isolation. So, you know, that was real comfort for us, and it meant that we have been able to make decisions that are more long-term in approach. We've worked out, I reckon that they should give us at least 2 years to allow us to get our service back up to the level that we were operating at before. And I suspect even higher after this, given the problems. I mean, these were the families that couldn't travel on public transport in the first instance because of various problems to do with their social or health issues. I suspect that's going to increase now, given that. So we did get, so that was really comforting for us all. We spent a lot of time speaking to other charities and to other community transport organisers. We've linked into national networks now, which we hadn't done before. So perhaps, do you want to go to another slide, Hayley? There's a little bit at the back of the bottom of there, I think, virtual board meetings, quick upskilling on IT, because like our board members, like most board members, tend to be older, not necessarily IT competent, but everybody switched really fast and that. But I think it's really important to understand that last year, the year before, we had a new upgraded IT and customer management system put in. So we have a very good, high quality database, which I must admit, when I first went to the charity 6 years ago, I was quite, they were using a 20-year-old Access database, which was in danger of falling apart. But everybody in the charity got used to working with it. And so they told me one day, oh, if you ask this computer to do anything, best thing is then you go away and you make a cup of tea and then you come back. And by the time you come back, it should have the answer for you. I'm like tearing my hair out because I come from a smart computer system. So, but we got, it's like, no, this is going to collapse. But everybody got used to working with it. So I think that's kind of one of the interesting lessons, really. You know, they just adapted with it and didn't realise, I think, that, hold on, this could be improved significantly. So that's up. And yeah, you know, and that was quite an interesting thing a project to undertake with them, because we're all new together as a team. You know what it's like when new people come together. They're all changing dynamics. Everybody's working out their position and their place, and what their roles are. So I think one of the benefits of having the new IT system fitted was the fact that we were able to work together as a team and all inputted into what we needed. So nobody was able to turn around and say, don't do what I wanted it to do. So, well, why didn't you not ask for that? You know, so yeah, I thought that, you know, that was very good, but vital and essential. And we wouldn't have been able to make the next steps really without that taken. So yeah, we've done all of those. So we got the new CRM based database in. Staff and volunteers and board members were all incredibly flexible. Can't say that that was always an issue. It's quite difficult to make these changes. I'm just remembering some of this is being recorded. Probably not say anything negative, really, should I? And I don't mean to, because mostly it's just standard group dynamics that are going on, which we all know and accept, you know. And that, but I will say, through the COVID crisis, everybody suddenly become remarkably flexible and prepared to make the changes and prepared to look at what new opportunities existed. And everybody, including me, you know, were able to say, hold on, perhaps it's not a time to say, well, this has always worked for us in the past. You know what I mean? So rethinking so, and I think it has made us a much more flexible charity and a much more flexible service. And I think we had you know, the Health and Social Care Partnership want to deliver care on a 24/7 basis from local communities, with local communities being involved in the delivery. And I think that what happened this year has enabled us to do that. But I think certain things were in place. Good attitudes, good CRM bases, plenty of flexible volunteers, but really importantly has been the support that's come through from the higher authorities, and that's been quite terrific. Finally, on there, a bonding experience for everyone in the charity, in the networks, in our volunteers as well. You know, I mean, some of our volunteers, you know, have really truly gone out of their way, worked well and over beyond, you know, their expectations, and that's been great. Final slide, thank you, there we go. Annual reports that we've had. Oliver, the little boy on the front there, Oliver, his mum is a single parent. Oliver was born with a genetic skull disorder. Mum was, when he was first born, he was treated at Alder Hospital. Mum, who's lovely, she's turned out to be an amazing supporter for the charity, was actually taking Oliver on the train to Alder from the far side of Oldham 3 times a week for specialist treatment. I don't know how she did it. I looked at the timetables and it looked to me like you needed to camp out on the station in the morning for her to get there on time. So fortunately our charity was already up and running, and her health visitor introduced her Oliver to us, and we've had a great relationship. Oliver, I'd like to say, is about 6 now, if not 7, is now just your standard naughty little boy. So, but has a fantastic relationship with a number of our volunteers who have taken him to Birmingham, to London, to Newcastle, to Alder, to MRI for many years now. And so, you know, and made that family's life so much more easier and so much a part of it. And being a charity and being volunteers gives us that flexibility. You know, quite literally our volunteers will go over and above, you know, and go that extra mile, quite literally, you know, take them home for tea and food and get them back. It really has been a personalised transport service for them. And we work with our families for many years, because more children, I think, are surviving infancy and managing to live with illnesses and disabilities that once upon a time would have probably meant a very short life for that child. Is they're now living much, much longer, much healthier. And, you know, it's because those services are up and helping them. And because there's a belief that they can continue to have happy, healthy lives, you know, apart from being curtailed. So we've got a business plan, if you look down there as well. So we've got, all of this can be found on our website. So the business plan, we believe, is still standing regardless of what's been happening this year. Again, the business plan says we want to be flexible. We want to work with the moral value, I think, that our volunteers and our staff place on the works that they're undertaking with their own community and their family. I must say, I come from a Greater Manchester background. Great Manchester Transport I worked for many years. So when I talk about local communities, I talk about Greater Manchester as being one of those communities. And then we drill down and there are more local communities and more local communities. So, and being from North Manchester, living in South Manchester, living over in Bury now, it's quite wide and it's engaging. And that. So I won't stammer my way through this any longer. But I'm really happy to talk about the work. I don't feel like there was so much. I was trying to give you a 40-year history in minutes with the changes that were going on. So it was all a little bit back to front, I feel. But I'm more than happy to go into detail about any of the aspects of the work we do. But we noticed last year there was a significant drop in activity, particularly over in Rochdale area, which was of great concern. And I'm looking all at the data and I'm thinking, why has this happened? 50%. It turned out that it was just one referrer had left the organisation that referred through to us. So in a way, that was quite an interesting find, But I mean, with a lot of those families, obviously, were being channeled through her. And then, so the charity was quite vulnerable to just this one person, obviously. But so, it's imperative really that we continue to put our service around to the networks so that everybody knows that we're there and that we can get to those more vulnerable families that don't engage with all of the networks that we would want to, but engage. So I've been out giving information, for instance, over in one of somewhere like Partington, where you've got a lower income estate areas with a lot of health, because a lot of people who have health problems, their children suffer from them as well, for exactly the sort of reasons that I try to outline here. So if we're looking at a social inclusion agenda, it's really important that we do. And have our volunteers older. So, if you want to talk some more, I can talk for hours. So about the charity, feel free to ask me any more questions.